And the meeting is now being streamed live, so all of you can see us even on YouTube. So welcome guys, and this is going to be a very short session on management of a simple ovarian cyst, right? So what I'm going to do is I'm going to start off with the whiteboard. And Atul sir, I hope the whiteboard is nicely visible to everyone. Yeah. So our topic is very simple. What is a simple ovarian cyst, right? So remember, this is something which family physicians are going to commonly see, because if you look at the uterus, you have the uterus like this. You have two fallopian tubes, one on one side, the other on the other side, and you have ovaries, right? Now, ovary is typically going to have two types of cyst which are going to be reported. One is a simple cyst, right? And another is a complex cyst. All of you probably agree to this. You would have seen reports which state that complex ovarian cyst seen. You would have seen reports which state that simple ovarian cyst. So what is a simple cyst? You know, if I look at the ovary and if I just magnify, so let me just magnify this ovary for all of you, right? So let's just magnify this ovary, right? Now, simple cyst is something which is within the ovary, but the contents inside, okay, the contents which are present inside are clear contents, okay? So it's most probably just fluid filled. Second, there is no septation. Okay, you would have seen it many times. You know, the ovary has septations, the cyst has septation, and all these things. Whenever you are looking at a simple cyst has no septations. Okay, and it is thin walled. So the wall of this cyst, this wall of the cyst is going to be a thin walled cyst, right? Now, today we are going to be discussing all simple ovarian cysts which are going to be less than 4 centimeter in size. That is our target of discussion. So what is important? You know, less than 4 centimeter ovarian cysts are going to be predominantly functional cyst. So what is a functional cyst? Now, in order to understand what is a functional cyst, let's just see the diagram of the ovary again in a menstrual cycle. Very simple diagram, right? So I'm just drawing the ovary here. Right? What typically happens when a lady is on day 1 or 2 of menses, multiple follicles will start and get recruited, out of which approximately on day 6 or day 7, one follicle will become the dominant follicle and others will undergo atresia. Sometimes at around day 10 and 11, this will become a big follicle. Okay, and sometime around day 13 to 14, this follicle will become the dominant follicle, which is going to rupture, releasing the egg. After that, it forms a corpus luteum. Correct? This is what we all know. This is corpus luteum, post-rupture. Now, this is what we know in a normal menstrual cycle. Correct? We've all studied this. So, what happens is sometimes, this follicle, which has formed a dominant follicle, does not form a corpus luteum. Understanding this step doesn't happen. So it stays as it is and it just goes slightly larger in size. Now this is going to be around 18 to 19 millimeters and it becomes slightly larger in size and becomes something called as a simple cyst, which is also a functional cyst. Typically, in women in whom we have a simple cyst, the only complaint the lady can have is delayed menses. Okay, it is delayed because corpus luteum is not formed. Because you don't have a corpus luteum, there is no progesterone, and because there is no progesterone, there is no withdrawal. And because there is no withdrawal, the lady comes to you with delayed menses. And then when you do an ultrasound, you realize that there is a functional cyst. So whenever you see a functional cyst, the first thing as a GP you must see is you must look at the uterus and you must look at the endometrial thickness. You must understand that what is the endometrial thickness. Correct? Very, very easy. So if the endometrial thickness is more than 7 millimeter, the treatment is to give progesterone. Okay. If the endometrial thickness is less than 7 millimeter, the treatment is to give oral contraceptive pill. It is so simple. So simple. Understanding, if the thickness of the endometrium is more than 7 millimeter, you must give progesterone. Progesterone is the standard progesterone. You need to give registerone, which is 10 milligram, one in the morning, one in the evening for around 10 days, following which there will be withdrawal. And if the endometrial thickness is less than 7 millimeter, you can give any oral contraceptive pill for 21 days. That's it, right? Now, quite a lot of times people get worried about a functional cyst. Whenever this is reported, your radiologist will say, kindly do a CA125 correlation, kindly correlate with CT scan. Trust me, all these things are not needed because a CA125 will be normal. All right. But there is one important thing which a family physician should remember. Okay. A simple ovarian cyst usually occurs and is usually seen in the women who are in the reproductive age group, right? So we are typically going to see this in women between age 15 to 45. Usually after post menopause, if you have an ovarian cyst, it needs a follow up. Otherwise, a simple ovarian cyst absolutely doesn't require any form of follow up for your patient. It is one of the simplest things to manage. It is one of the things which creates a lot of confusion in the minds of family physicians. As a result of which, we decided that today, when we discuss, we are going to be discussing about the management of a simple ovarian cyst, right? I hope this very quick session, around 10 to 15 minutes, as we promised, has been beneficial. We will see you guys again on next Monday for more live sessions.